Hello, my name is Jack Glover. Today, for my individual presentation, we'll be covering meningitis, a nervous system disease, and in specific, we'll be covering the bacteria Neisseria meningitidis. So let's go ahead and get started. So let's look at some general objectives for today's topic and presentation. We'll begin with an overview of the so-called highlight disease in the central nervous system known as meningitis. Some signs and symptoms regarding the disease and the specific bacteria we will be focusing on. Pathogenesis, so how the disease develops and its progression through history, as well as in the human body. Transmission of the disease, so factors that contribute to transmission from person to person, settings, and common outcomes. Culture and diagnosis, so how we are able to identify the disease, the specific steps that must be taken and action that must be taken to do so, as well as steps that can be taken to prevent the disease and methods of curation. So let's go ahead and get started with an overview. So meningitis, from a general standpoint, is an inflammation of the meninges. The meninges, in specific, are layers of membranes that cover and protect the brain and spinal cord. These include three general sections: the dura mater, the arachnoid mater, and the pia mater. There are many different organisms that can cause an infection of the meninges, but today we're going to focus on a more serious form caused by a bacteria. So let's go ahead and take a look at the specific bacteria. So Neisseria meningitidis is identified as a gram-negative diplococci. These are often round cells that occur as joint pairs, and they're often referred to, as will I in the presentation, as meningococcus. So meningococcus accounts for the most serious form of acute meningitis. In total, we're looking at about 15 to 20% of all cases. So there are over 12 different strains that vary depending on their capsular antigens. But serotypes B, C, and Y are the most prominent in the United States. And in specific, serotype B is most prominent as it is related to us. And its ability to spread rapidly on college campuses, within college dorms, and a college setting. So there are also developing serotypes A and W that can be a cause for concern as well. A little bit of a fun fact is that 1 in 10 people actually have the bacteria present within their body, within their nasal cavity, without it actually causing any harm. So the bacteria has an IgA protease, which is important to understand. It's able to resist protein, and a capsule that results in its ability to overcome the body defenses more easily and entering the immune system. So pathogenesis, so we're looking at how the bacteria enters the body and the steps it takes in the process it goes through to often result in the dangerous disease it can be. So it enters the body through the upper respiratory system. If we're looking at the roof, the nasal cavity, this is a highly vascular at the base of the human brain. So from here, it has the ability to move into the blood and penetrate the meninges, and from there produces immediate symptoms. The symptoms are onset, and they rapidly arise. So the pathogen releases endotoxin into the generalized circulation of the blood, which results in a reaction from the white blood cells. So this reaction comes in the form of release cytokines. They're released from macrophages or lymphocytes. This is a negative response, and it usually results in vascular collapse, hemorrhage, and crops of lesions called petechia. So these are very small purple spots that can be visually seen on the body, on the skin. They typically appear in clusters and may look like a rash. But this is a very apparent symptom of the disease itself. So let's take a deeper dive into some symptoms. So from a general standpoint, you're going to develop a fever that can be very extreme, over 104 degrees Fahrenheit, and this can occur very early in the onset of the disease. Stomach pain is also a common early symptom, as well as sore throat, chills, widespread internal bleeding under the skin, which results in the rashes, and then an increased number of white blood cells, as we mentioned previously. So let's go ahead and move into transmission of meningococi. So the bacteria don't survive long in the environment, so they're usually acquired through extreme close contact with secretions and droplets of liquid. It can be spread through coughing, sneezing, kissing, any general sharing of saliva. So the bacteria is contained as a reservoir within the human nose and throat. Historically, it's been epidemically instanced to occur late winter and early spring periods. So we're looking at January and February as the leading months of cases. High-risk groups include young children ages 6 to 36 months and older children ages 10 to 20. Close quarters provides the highest risk. So some examples of facilities: daycare, college dorms that we mentioned previously, military barracks, and then generally anybody who resides together. And like we had said, January and February, leading months of cases. It's a period where it's usually temperatures are down, people are indoors sharing small spaces, increasing the risk of the disease. So diagnosis. So confirmation of the disease is extremely important. It is a viral, it's a very rapid and pivotal process, and it has a very extremely high fatality rate in severe cases. So you want to begin with a staining and observation as the first step of the process. So cerebrospinal fluid, blood, and nasopharyngeal samples are where this process will begin. As you can see, cultivation is the preferred method of diagnosis. It offers a quick assessment of susceptibilities, of the antimicrobial susceptibilities, and its specific rapid tests are also available without culturing, but like I mentioned before, cultivation is the preferred method as it is more effective. So to effectively identify the genus itself, you want to begin with the gram stain. You're looking for a negative culture. So once you receive your gram-negative bacteria, you want to isolate the bacteria onto a single sample plate. And once you are able to sample the gram-negative bacteria, you want to perform an oxidase test. So an oxidase reagent will be placed onto the gram-negative sample plate. If the colony is to react to the chemical, it will turn purple, a purple to black color, meaning it is oxidase positive and the meningococcus is present within the sample. So looking into preventment and treatment for the disease, so the background infection rate is 1%, so there already is a well-developed natural immunity to the meningococcus. During the earlier periods of life, people are exposed to the bacteria and its close relatives, resulting in an antigen production early on, which is good. Vaccination is readily available within the United States. First dosage is typically offered to children at the age of 11, followed by a booster dose around the age of 16. The vaccine is also available for adults over the age of 55 and anyone who is high risk to the disease. And your therapy typically comes in the form of viral antibodies as the form of treatment. This can occur through one or several drugs within high dosage. So that concludes the content within the presentation. Here are several of the resources I use to research and put together everything. I hope you enjoy my presentation. Thank you for your attention.